Hello, everybody, and nice to see you again after the Academy meeting in Miami. It was a nice time to spend all, and including our families and colleagues and friends. We had a nice panel to really go over on management and evaluation of neck masses in adults and sort of go over what we really are struggling and seeing in our clinical practice every day, whether it's in an academic center or a community practice or a community office. And one of the things we looked at is to really think about that as an approach from an adult and how do we actually evaluate the patient, including the physical exam, endoscopy, imaging, as well as biopsies and the workup of such en masse. And really this was centered on a review of what the clinical practice guidelines that the Academy has published in the past, and something that is not only available to everybody for review and use in an everyday practice, but also as a way, as a resource to make sure that we follow a logical progression. Some of the key takeaways from this really are centered around the fact that an adult neck mass is really a cancer until proven otherwise, and really need to exhaust all possible diagnostic things to make sure that we don't miss that diagnosis. And this really starts with not only the physical exam, on the mobility of the mass, also endoscopy to look for any mucosal or lining cancers or masses that look atypical, and biopsy as needed. The next step really is to think about doing the biopsies, and really preferred method is to use ultrasound to make sure we have a higher yield and actually examine and sample the correct part of the mass so that the pathologists actually have additional tissue to give us the diagnosis. And only then make surgical plans or management decisions once you establish that diagnosis, which is really the most important part of this. You really want to exhaust all the diagnostic possibilities, including biopsies, to make sure that we have the information you need to make the evaluation and management plan, including possibly surgery on these patients once you arrive at the diagnosis.